We know, and we've seen it every day in the headlines and the news about the dramatic casualties and losses in Ukraine, as well as, of course, an ongoing burden of disease that preceded the war, an ongoing pandemic from COVID-19 and other viruses, attacks on healthcare facilities. And some would say Ukraine has not experienced this level of health crisis since the Second World War. Could you give us a picture from where you sit of what the health situation looks like?
Despite signing on to Geneva Conventions, the 1949 Geneva Conventions, Article 18 states that medical facilities may in no circumstances be the object of attack. And the UN Security Council Resolution 2286 from 2016, in which all parties were urged to make efforts not to include medical facilities when there is a conflict. Russia has continued to target, not just have damage done, but also to target healthcare facilities. There's been 171 facilities completely destroyed, and the Ministry of Health reports that about 1,200 facilities have been damaged, anywhere from 10 to 90%, where they're partially usable or unusable. An NGO named Ukrainian Health Center has documented 309 attacks on the healthcare system, including deliberate targeting. That is, that it's not collateral damage, but actual deliberately targeting the healthcare facility itself. And between February 24th and April 7th, in the very beginning of the war, there were 184 attacks on medical facilities. That's 5 or 6 every single day. The healthcare system in Ukraine has actually continued to function pretty well overall. There is a growing number of civilians that need healthcare and are coming to the facilities because of chronic diseases, because of injuries. However, there really has been a pretty good response in the healthcare facility, and it has been helped along quite a bit by our partners, such as the World Health Organizations. Now that there has been, since October, quite a problem with electricity and with power, there have been thousands of generators that have been brought into the country so that we can continue to have essential services such as healthcare to be given to the patients. So now when you walk the streets of Kyiv, you hear quite less traffic and cars driving on the streets because the city is a bit emptier than it was before. But there's a new sound. On top of the air raid sirens, we also hear the generators that are on constantly. There are rolling blackouts in the city as well as in most cities here in Ukraine, and that really causes a problem for healthcare facilities. They can somewhat plan for when they will have power, but the rest of the time it's done on generators.
What is striking, as Ulana depicted, somehow this concurrence of both a devastating impact of the war and at the same time some, quote, normality and largely functioning health systems because of the resilience of the system and the resilience of the people. I don't know whether you would agree with this estimate, Ulana, but let me say something like 85% of the system is actually functioning, despite the infrastructure damage, despite the logistics disruptions, despite the human resources constraints that she discussed, and despite the huge burden and challenges raised by the large number of internally displaced people. So both the international solidarity and the internal resilience of the medical system and of the healthcare personnel is keeping the system with major challenges, I think, with chronic diseases, indeed, and with mental health. According to WHO, somewhere close to 1 in 4 people in Ukraine are at risk of significant mental health conditions.
Mental health is going to be a very big challenge. As Michelle said, 1 in every 4 Ukrainians, or about 10 million Ukrainians at this point, are at risk for having mental health issues as time goes on. But there's a very specific issue here that as well. As many of you probably know, sexual violence is a war crime, and it almost always accompanies war. It's another weapon that the Russians are using against the civilian population in Ukraine. There is a site, www.warcrimes.gov.ua, where those victims of any war crimes can report those crimes. We have encouraged the NGOs to speak to and have connected them with experts in the field from places like Kosovo and places like Israel, where these kinds of sexual violence, trauma, war crimes have occurred in the past. And so that has been very helpful. But one of the things to move forward is in looking at aiding in treatment, identification and treatment of mental health issues is this separate area that really needs to be very well funded, very well documented, and also very specific training that's not the general training that most physicians, most psychologists, most social workers have.
We've seen that there has been a lot of financial and other kinds of assistance mobilized from Europe, from other parts of the world to Ukraine. To what extent have you seen this putting strain on budgets for other kinds of international assistance? Can you give us a flavor of some of the debates taking place in your capital in Stockholm and or more broadly among member states of the European Union, which when we add up all of the contributions of EU member states, the EU is actually the single largest funder of global health initiatives, but also, of course, one of the most significant sources of financial support for Ukraine.
I believe that there is some reason to be cautiously optimistic about our support to health globally. For the Swedish EU presidency, nothing will be more important than our support for Ukraine. In terms of funding, well, Sweden as an example, we have increased our support to Ukraine by 900 million euros in support in 2023 alone. We've given or committed 400 million of military support to Ukraine. This is large sums of money, and they're coming from all over Europe, obviously. In our case, our government has been very clear that Ukraine is the #1 priority for also our development cooperation during the EU presidency. At the same time, the second priority for the Swedish EU presidency in this field is global health, and the third is corruption. We can and we will combine the engagement with Ukraine with global solidarity on issues such as food security, climate change, and global health.
The international support that we've received in Ukraine actually has been ongoing. Starting in about 2016, we proposed a healthcare change in the way the healthcare was financed, as well as changing to having more emphasis on primary healthcare. So we need to continue to concentrate on those reforms, on building institutions, making them stronger, and ensuring that, the third most important thing that the Swedish minister talked about was corruption, to make sure that there is no corruption in the system so that the patients are receiving as much aid as they possibly can be receiving without any problems. It will be quite a challenge when we're rebuilding. One of the things that that's a very, very big challenge now and will be later is economically, finances. Much of the aid that's coming in now is coming in from the outside and being brought into Ukraine. I think one of the things that can really help the World Food Bank, I believe is the organization, the way that they provided food aid in the beginning of the war in Ukraine was they came and they contracted local businesses to provide food for Ukrainians that were either displaced or in the beginning of the war when there was no delivery. And I think that maybe some of the aid that's coming into Ukraine should be invested in Ukraine rather than being brought in from the outside. What we've seen in the medical field, actually in pharmaceuticals, is because of the lack of imported medicines coming into Ukraine because of logistics issues, there's actually been a 57% increase in use of Ukrainian-made, locally made medicines, and there hasn't been any ill effect from it.
What kinds of impacts are you seeing in food security and nutrition worldwide, but also particularly in the region where you're based in the Middle East and North Africa?
We have to understand that Ukraine and Russian Federation are one of the largest producers, or the Black Sea region is, in fact, for the cereals. A lot of world depends on the Black Sea for cereals exports. What we had was a supply issue to start with, but all of these things, when they were compounded, they increased the food prices as well. The FAO Food Price Index, which is one of the trackers of the global food prices, saw its peak in 2022. Fortunately, from September, October onwards of last year, we have seen again a calm down, or let's say a smooth sailing of the prices, but there was a huge increase. Now, when we go to the member countries, for example, to convince them or to support them in adopting the nutritious or healthy diet policies, very rightly, the policy circles would ask us the questions, are you guys crazy? I mean, we are worried about the availability of food to start with. We are worried whether we would have imports of these foods, from certain countries. And you're talking about the healthy and all of these things. And in many of the countries, particularly, in our region or the developing countries, people think that this is like a rich man's club type of a thing, that you're talking about healthy diets. The long-term cost or long-term implications on the public health expenditure when we talk about less nutritious diets and the generational losses that we have due to lack of nutrition, particularly in women. But that is a very hard sell. I mean, let me tell you, for now, the immediate question would be, what can you do for us to achieve the food security, or let's say the availability of the food? That we have to find out not only the alternative sources or resilient supply chains, but we have to basically point out even more this drive towards the cost aspect of the food or the availability aspect, and ignoring the health or the nutrition aspect of the food. What are the public policy costs in the longer term, and what countries would suffer if they go for money rather than the value or the nutritious? A global food systems reset was due in any case. It is happening now, triggered by these two events, as I said, COVID-19 and the Ukraine conflict. A lot of knee-jerk reactions that we saw was going towards the self-sufficiency in food, which is fantastic. But from a practical perspective, more than 100 countries can never be self-sufficient due to lack of resources, or let's say due to the natural resource endowments and increasing populations. We need to have resilience in the food supply chains. We need to have some global mechanisms that guarantee, the situations or the shocks, because what happened after this, from February last year onwards, was some of the exaggerated reactions or actions by the governments, which may not have been needed, but logically, when it comes to food, you cannot question any government's right, because there is a right to food. But as they say, there is always an opportunity in the crisis. So probably this gives us an opportunity to sit together again at the global level, carve out the things, that were not working in the health systems or the food systems, and then come up with a consensus that would be really beneficial for all.
The impact is devastating on Ukraine, but it is also there's also a broader regional impact of the war. In the Kyrgyzstans and the Tajikistans of this world, that are dependent on the Russian economy very much. The currency has dropped. The inflation is very high, and the budgets on health are decreasing, and there is a significant impact that can already be seen and that can only worsen in the coming months. There are the public postures, as always in diplomacy, and these are very tough, very abrupt these days. And then there are also discussions that are not so public. And I believe that some discussions can take place also on this critical issue of health, because wherever you are, a patient is a patient, and our mission as WHO, as health organizations, is healthcare.